Hey guys, Dr. Matt Fontaine here. We're going over a quick little graph that kind of shows how people get hurt over time, from a high level. So what we're looking at here is just a basic graph. This top line here represents your capacity at full health, okay? And there's three major blocks that will diminish from that capacity over time. So the big takeaway here is injuries are cumulative over time. And the first block we're going to look at is anatomic deficit. Now what that means is if you have some arthritis in a joint, maybe you have some partial tearing, you could have a meniscal tear in the knee, a labral tear in the hip, a rotator cuff tear in the shoulder, or a labral tear, a disc injury in the back. That creates an anatomical deficit, and a lot of times those anatomic deficits are irreducible, meaning a torn rotator cuff is irreducible until we do surgery or maybe some regenerative stuff. So the second block is looking at fuel, sleep, stress, and recovery. Pretty straightforward there, guys. How well are you sleeping? Quality sleep? Are you hydrated? What's your nutrition like? How are you dealing with stress? How are you recovering from workouts? All of these things in the box can be dealt with adequately to shrink that box, or if we're not handling those well, that box becomes bigger, and these blocks take away from our capacity, which basically lowers our threshold to be able to handle day-to-day activities and including sport. Functional diagnosis, these are things like how well do you move? Do you have restricted joint movement? Things of that nature. Do you have scar tissue? And looking down here, scar tissue develops basically due to repetitive motion. So we start to have tightness in the muscle, creates friction, pressure, and tension over time. We continue to do the said activity, i.e. running, working out, and we start to develop adhesions over time. One of the other things that we have on the board here is guarding after an injury is normal. The tissues heal, but the muscles learn and readily develop habits of guarding that outlast the injury. Basically what that means is all stress in the body is cumulative. If we have a perfect recovery and we get some treatment after an injury, we can bypass this guarding that continues. But for most of us, we have injuries we don't fully deal with. And so even though the tissues will heal over time, usually with scar tissue, that guarding can be a recurring thing. So these three blocks are the major things that detract or help to increase our capacity. And so this box up on top of this is ADL. That's activities of daily living. Those are the things we do day to day. And then on top of that, WOD. So that's your workout, your sports, your recreation. So we try to add these blocks on top of these three major categories that are basically determining our ability to handle load over time and our functional capacity. So this is a very basic of how people get injured over time and or how well are they recovering. Just a real high level view, and thanks for watching. We'll see you on the next video. Take care.